Hi everyone, and welcome to the first AIMS Working Age webinar. I'm Harriet Clark, Head of Quality and Accreditation at the Royal College of Psychiatrists, and we're pleased to welcome Ellie Walsh, who's Chair of the AIMS Working Age Advisory Group, who's joined by Suzanne Brown, and they'll be talking through some of the challenges they've been facing at Navigo in relation to COVID-19 and how they've been addressing them. Before I hand over to Ellie and Suzanne, I've got a few housekeeping points to start with. Firstly, the webinar is a live event, therefore you'll be on mute unless you're a speaker. The webinar will be recorded and uploaded onto the AIMS Working Age webpage. If you have any questions throughout the webinar, please use the chat function and you can vote for the ones you want answers to the most. If you can't access the chat box, please email us at aims-wa@rcpsych.ac.uk and we'll pick up your questions. You can also use the chat box to let us know if you'd like any specific topics covered in future AIMS Working Age webinars. I'm now going to hand over to Ellie and Suzanne.
Hi, I'm Ellie Walsh. I'm an acute service manager from Grimsby, North East Lincolnshire, and I've got Suzanne Brown, who's my senior operational manager with me. We are practicing social distancing, so if you can see us on your screen, then we are tiny because we're trying to keep apart. I've done a presentation which I'm going to share with you, and what we really want to say is this is just how we've addressed the COVID-19 situation within our acute trust, and we're not telling anyone this is how you should do it. We're just sort of saying this is how we've done it, and we would really look forward to some feedback and some direction if people think that we could do things differently as well. So as I said, I'm Ellie Walsh. I'm assistant director. I've got my own title wrong there, and we're all about sort of AIMS accreditation, about Star Awards, and like yourselves. Oh, someone's just taken my control and lost my presentation for me very briefly. Just a minute. Yeah, so we're all about AIMS, we're all about Star Awards, and like yourselves, we're in a very different time now that I never anticipated that we would be working in the situation that we're in. Like many of you, it's a completely different world to what mental health nurses and Suzanne's a social worker that we've actually trained to do, wearing scrubs, donning and doffing. A lot of it's a new language for us. So like yourselves, we're on a really difficult journey at the minute. So I'm just going to go through some slides. It would be good to have some questions. It would be good to get some feedback from yourselves as well on what we're doing. Suzanne's going to join me. Just bear with us because we've not done this before.
Oh, will we get the chat function?
Yeah.
Just next.
Okay. So as I said, the intention's not for us to be telling anyone what to do or how you should do it. It's just this is what we're doing, and like yourselves, it's a bit of an opportunity to undoubtedly learn from others and some of the thinking outside the box stuff that we're all doing on a daily basis. So ourselves, we had two 11-bedded mixed sex acute wards. Each ward had its own team, its own full-time consultant. Doctors, like many of yourselves, start at 8 o'clock in the morning. Handovers were a full MDT. We're really flexible on how we work. Reviews are for service users as and when needed, and often more than once a week promoting early discharge. We have an average length of stay that varies between 8 to 18 days. Our crisis service are integrated into acute services, so crisis liaison and the AMPs are all part of our team. So we tend to speed things up a lot quicker, and as we prevent admissions, we also facilitate discharge quite quickly. And we also are reluctant, and I say this in the best way, and it'll explain itself as we go along. We're reluctant to admit people with emotionally unstable personality disorder, as we have a really specialist service for that group of people, including a therapeutic community on site, which Suzanne manages, as well as the acute inpatient services. So what have we done? We took one of the wards, which was built, it's built on a T. So we split the ward in half. So any admissions that are coming in in line with well, let me start again, sorry. So we split it by wing, and then one wing is for admissions in line with infection control, and we're testing each admission for coronavirus, and the other side of the ward has become a COVID positive area, which we've locked and we're managing really strictly in line with infection control guidance. And then once the test result comes back, if someone's negative, they leave that ward completely and go onto our other ward, which is a COVID-free ward. Staff hours, that's been really interesting, because I think nationally there's been quite a dip in admissions, and we've seen with across our STP, which is Humber and Yorkshire, there's been a dip in people presenting in crisis and liaison. So we're currently managing our beds really well, and so what we've done is we've adapted the staffing levels accordingly. So rather than have too many staff on shift, we're supporting planned annual leave, so we've not cancelled any annual leave. We're asking staff to bank their hours as well, so that we can use them, because like yourselves, we are anticipating that we're going to get busy from a COVID positive point of view, and that we'll also get busy with admissions once the area escalates with COVID positive, because we're quite behind the southern area, and so we're not seeing the spike that many areas have got already. And we're trying to avoid using bank and agency, so that we're reducing cross-contamination, because obviously agency staff work in other hospitals and might not have the same sort of infection control procedures that we've got in place. So we're trying not to use any agency. Go on.
So with regards to banking the hours, we're monitoring that really tightly, so we don't bank the same staff all the time, that we're trying to make it fair, and hopefully at the end of all this, we might even be able to write some of the staff hours off. So it's important that we're not banking the same person all the time.
And then from our Band 7's point of view, from Band 7's, myself and Suzanne, we're all doing a lot more clinical work, so that we're out there as visual leaders, and we're facilitating a lot of live supervision as we go along. So we're keeping staff and service users' morales up. But as we're getting really pressured for time and doing different things, regular supervision hasn't been as good as it should. So we're using real live supervision all the time. And working really closely with all the staff. So the admission ward, it's all the bedrooms are single en suite. When crisis, who are gatekeepers, see people, they do tell people that they will be going basically into an isolated area, and so that if we can provide intensive home treatment to avoid admission, then we'll be doing that. Each admission is swabbed and isolated in the bedroom until the results come back. And when I say isolated, the staff are constantly on the corridor with people, so no one's sort of locked in a room on their own. Meals are in the bedrooms. All staff are wearing PPE, and we've equipped all the bedrooms with a TV, with a radio, access to fresh air, Wi-Fi, and a tablet, as well as other things, so that people aren't in their own by themselves, which would be really quite bleak, wouldn't it? It's a bit like if you had to isolate at home in your own bedroom. And then once the results come back, the patients go on to the non-COVID ward, or if they're positive, they go on to the other side, which is the COVID ward. And then we treat all new admissions as if they are COVID until we get the results back. And from a staff point of view, we're monitoring staff's temperatures twice daily or twice through the night as well, just to keep an eye on staff, because we have had staff COVID positive and staff self-isolating. The COVID ward, it's operating as its own unit following PHE and PPE guidance, and then we're using guidance from the infection control team. We have got don-in and doff-in stations, as you will have, preventing cross-contamination. And then we're also constantly monitoring the patient's mental health as well, because while we're dealing with the physical health, it's really important as well, obviously from a mental health point of view, to watch the mental health. And then we're constantly looking at, does that patient actually need an admission? Could we monitor that? Could we maintain them at home? And obviously leads into the dilemmas, which we'll talk about later, about sending people home who are positive. The consultants are using Zoom a lot, so they're zooming into handovers and they're zooming into reviews, zooming home with patients' families and things. So Zoom's working for us. I know there's a lot of issues around using Zoom, but it goes for us. We're just aware that Russians might be listening in, so we're just a bit careful at times. And then we also have a strategic daily meeting on Zoom, which I go on and Suzanne goes on with the chief execs and all the other leads from across the area. And we also have the opportunity more or less daily to discuss medication, if we need to go over BNF limits, if we're looking at managing challenging patients that way. So going above and beyond, we look to our community colleagues, and obviously our CMHT, our assertive outreach team, forensic teams are all still working. Often they're working from home, but they are Zooming or they're actually going out and seeing people. So they're looking at putting intensive support into people at home to prevent deterioration, which we're seeing with some of the severe and enduring patients in the community. We're also looking at people who are isolated at home who are at risk of deterioration. We're looking at using local residential homes, if appropriate, and offering them some respite. And then our therapeutic community is running via Zoom really, and on the phone, and because we have 20 people in our therapeutic community, so they're doing daily groups on Zoom just to try and stop them presenting to crisis or down at liaison. So we've had our first COVID positive patient, and she actually came from the acute hospital, and it was a delirium presentation following, it was post-operative. Once we got the result, we did nurse her on the COVID ward, and on discharge planning, I guess for us, unlike I guess in the acute hospitals, people come in for an operation, or if they've got COVID, and then when they're ready for discharge, they go home. We felt we had quite an ethical dilemma about going home to an elderly husband. I think he was 78 or 79. They had no family nearby that one of them could go to. So we assessed capacity for both the patient and a husband on understanding the risks, understanding social distancing. We did offer one of them hotel accommodation, but they reassured us that they would be safe in their own home. So we discharged and supplied masks and home treatment and picking her up to do that piece of work now with her monitor mental health. Practicing social distancing. We like our 2-metre ruler, so it's a good mark for keeping a distance. And then we also had, at the beginning of the social distancing, we had some of the service users as our social distancing monitors, so they were telling us all the time to separate and things like that, so that was a good reminder for us. And then we just sort of together we can beat this, and we have a big thing of we're in this together. It's not just one person. I think most people would say that they're actually scared at this time. If they're not scared, they're anxious, and I think that's quite just to be like that. Therapeutic activities are so important. It's been really key to keeping service users going, really, because obviously well, we're not facilitating Section 17 leave, but we have got beautiful grounds that we can go on. We've got activity coordinator, and she's also personalising activities for the service users who are on the COVID ward. We're doing wobble rooms for staff. We're doing incentives for staff. Easter weekend, we did excuse me, we did free meals for all staff. So we've got quite a few things going on. We've got a gym instructor who is doing activities for, well, is doing gym activities for staff and for service users. I say we bought tablets specifically for service users so they can Zoom and FaceTime family and friends. And both Suzanne and I are available 7 days a week. If not in person, then we'll Zoom in on a weekend and check everything's okay, or if there's a problem. It might seem a bit extreme 7 days a week, but for us, if we can keep the staff settled and we can keep the staff grounded, then the service will continue. And it's a bit of a don't wobble alone, let's wobble together, really. Couple of things I pinched off Twitter and off the Safe Wards Facebook. That's Natalie Brown up at Gateshead. She's converted an old drugs trolley into a sweet shop. So and a few supplies in there, so people who can't go out can actually get some treats. And they're not making a profit from that, she told me. And then, oops, I've got the wrong picture on that one. So excuse me for that one. And then I think that's it from a presentation point of view. Suzanne, did you want to add anything into that?
No, it's good. Thanks, Ellie. I'm happy to answer questions with you.
Okay, thank you. Just bear with us while we change the screen from the presentation.
Where is the mouse?
Okay, and where's the question? I can't see the questions.
On the chat.
Is it on the chat? Okay.
That's your chat.
There. Oh. There's only 3 in the meeting.
Where's your chat? Share a conversation. That's your chat.
There's no chat.
Where's your chat?
Harriet.
Okay.
Harriet?
Yeah, can you open the Q&A section?
Bear with us.
Get back on there.
Oh. We thought that we were in this just with yourself, Harriet. Yeah, we found the questions now. So we'll work to the top of the questions, if that's all right. And if people want to, oh, I've gone wrong again. Bear with me a minute. I really shouldn't be allowed to touch any buttons. We just take that to the top, okay? Right, thank you. So Polly from Lincolnshire. Yes, we're testing everyone on admission, and we are treating everyone as positive until we get a negative result. Rob Chaplin, I think we've answered that one around activities. We are constantly adapting our activities, and we're really flexible. Section 17. We're not facilitating any Section 17 leave, which we are. That's why we're trying to get a fast turnaround and discharge so we can get people home.
No visiting.
We're not having any visiting, although I am aware that there's some new guidance out. I think it was yesterday, which I haven't read yet, about which questions whether we should be stopping visits. So we need to have a look at that. So we talked about supervision.
on the wing.
Yeah, Katrina, we've got the 2 wings, so all patients are on, they go on one wing until the results come. If they're positive, they then move on to the other side of the wing, and if they're negative, we've got another ward where they go over to. So all the patients are negative on that ward, and we've just been really careful with staff as well. So staff are using PPE and masks because we're quite cautious that staff might actually give patients the virus, because obviously you don't know as a staff member if you're carrying the virus or not.
So we're treating all new admissions as if they are positive until we get a negative result.
Yeah.
To contain this situation.
Yeah. Our consultants attending the ward. Consultants are coming to the ward, but they tend to zoom into the ward more than they're coming onto the ward. Is that right, Suzanne?
The consultants are on site. They're working. We're currently doing, in theory, 3 days at work, 2 days working from home. So the consultants are available 5 days a week, and the consultants are around in their offices if you want a face-to-face, but we're encouraging everyone to do distance and Zoom conferences. And feedback from the service users, the patients, has been really positive, because family members can be in, care coordinators can be in, so the reviews are quite well attended on Zoom.
Yeah, and junior doctors are on site as well. They are going onto the inpatients when they need to, and we're trying to reduce the footfall altogether onto the inpatients. So if someone doesn't need to go, then we don't want them to go on unless they actually need to. If that makes sense. Just looking at the question on training.
No, we're not. The only training we're facilitating is we've done a refresher for all physical training for all staff.
Yeah.
For observations, temperatures and that kind of stuff, haven't we?
Yeah.
But we are encouraging all staff to do the online training.
What is a wobble room? A wobble room seems to be a Twitter phenomenon, I think, and I think across the country there seems to be companies out there donating lots of things to inpatient areas, acute hospitals. So people are, I think it came from actually an intensive care unit, as in a physical intensive care unit, and it was just a space for doctors, nurses, whoever was there, just to go in when they're really struggling and just to have some quiet time when they're upset or they're really stressed or the face masks are blistering the faces. So we're just creating a wobble room on each of our inpatients, and we've also got rehab on site, and we've got crisis on site, and liaison are getting a wobble box, and then we're just filling it full of things like mindfulness cards, treats, sweets, cold face wipes, mindfulness colouring books, stress balls, hand cream, and we've managed to get lots of chocolate and things like that. We're doing group activities, so we're maintaining social distancing. So on the COVID negative ward, they are doing group activities
as usual.
Yeah,
keeping our distance. Staff wearing masks. Patients can wear the masks if they choose to wear masks, because we don't want them to feel invalidated, really. And some of the patients choose to wear masks, don't they?
They do. Yep. So yeah, we're quite happy for patients to wear masks, and we're in a very lucky position at the minute where we have got a sufficient supply of PPE. Very interesting question from Mr. Mike Reeve, who most of you won't know is my boss. How are you supporting the well-being of staff, Ellie, and yourself, with 2 question marks?
And yourselves, didn't Mike say that he was going to pay for us to go on holiday after all this was over?
Yes, he did. He said 2 weeks in, 2 weeks all inclusive in the Caribbean for band 7s and above. Not that we're discriminating, so all band 6, 5s, 3s, 2s, 1s and anyone else will also get 2 weeks in the Caribbean.
Not so really.
So thank you, Mr. Mike B, for that question. And not leaving the grounds, is that consistent with the rules that apply to the public? Yeah, well,
yeah, because we're living together, aren't we? Technically speaking, we are a unit in the sense with small numbers. They're going out in small numbers. They're not going out in large groups.
We're not on a big hospital trust. We are an isolated acute mental health hospital. So we do have beautiful grounds. The public don't access our grounds, so it basically is like going in the garden. So
in small numbers,
yeah,
not
small
in large
numbers.
Groups.
No. Are we sending positive people home if they're ready from a mental health perspective? I guess that's the dilemma that we've had, is that how do we know when someone's actually negative? So do you want to answer that one, Suzanne?
I guess we're a bit of a soft group here, in the sense we're fortunate that we've only had one positive person, and we had a family Zoom meeting really to say she wanted to go home. Husband, as Ellie said earlier, is in his late 70s. The daughters was quite concerned about the impact of her on him. So collectively we had the conversation and encouraged her to stay until she'd been here 14 days from the positive test. This lady didn't show any symptoms, and that piece of work worked out really well in the end. Leave for informal patients. When people come in on an informal basis, we're very clear that there won't be any leave, that we're concerned about if they go off on leave, they could come back and bring COVID back in. And again, they've worked really, really well with us. We have an MDT approach to this, to say, you know, if they feel that they need to be in. We had a situation today where somebody was admitted as an informal patient, and we've made it very clear what an informal patient really means. And should we consider the use of the Mental Health Act, because in theory we are being quite restrictive, you know, we're going against the realms of an informal patient really.
I hope that answers that.
Yeah, if it hasn't answered it, come back in anonymous with some clarity.
Yeah.
If we haven't answered it.
Or drop us an email as well.
Yeah.
I'm just ellie.walsh@nhs.net. I'm fine if you want to drop an email. And we are explaining to anyone who comes in informally what the process has to be. So there are choices, and we are offering intensive home treatment as well, to prevent admissions, to support people. Yes, all the patients are coming in through the one ward for admission. Veronica, how are we supporting families? Lots of telephone contact, lots of face. Well, we're zooming in with families as well, and then as I say, we've bought tablets, because not everyone has a decent phone that they can actually FaceTime from, and we've set Zoom up and things like that, so we can bring the families into the sort of remotely into the patients. Sanitary products. Last year we was really hot on that red box project, so last year we provide every variety of sanitary product that somebody might want, and they've always been free for everyone, so there's no problem with choice.
And we're using the 72-hour rule, in that if families want anything bringing in, or the service user wants anything bringing in, it's put in a bag, put in the sluice, left 72 hours, a bit like parcel delivery from Amazon, really.
Yeah, but we've got a little shop on site in any case, so and staff will go out and buy things for service users. I know people say patients, for us it's service users.
Thanks, Alan. It's nice to be appreciated on that one.
Just tell my boss is somewhere listening that we're good, so that'll be good for our holiday.
So Alan's saying, great to have a real leaders able and willing to answer questions. It's interesting, really, Alan, because often, many times in a day, we feel as if we haven't got the answers, but collectively, by talking and openness and honesty, we seem to be coming out with some out the box thinking, really.
This is one massive learning curve for all of us. I've had an occasion when an informal patient has gone out on leave for an hour a day. What if discharge isn't? We're not
allowing leave.
If someone wants to go home, then we would look at what are the risks, and we would be looking at facilitating a discharge with a supportive package. If the informal patient wanted to go home and we thought there was a risk, then we would have to consider an assessment under the Act. But as I said, we do explain to all patients on admission what the situation is, what's going on. So informal patients are coming in knowing what the situation is, and so as I said, there's no leave at the minute because we'd have to go through the whole process of retesting again.
And being really transparent about, what does leave mean, why the restrictions, and we was really transparent for informal patients when they first come in and throughout the stay. Why is it that we're saying, because ourselves as staff members, we shop when we need to shop, we go out. Our daily exercise, is done on the grounds. We're fortunate to have great facilities, and it's been accepted really, really well. Yeah, hasn't it?
Yeah, we've got a tennis court or a basketball court, and every day there is a physical activities, often more than once today. Often if the gym instructor is on duty, then he does it. If not, the other staff do it. Staff and service users exercise together because in theory we practically do everything together. In any case, that's the way we work. We eat together, we watch TV together, we exercise together. It's who we are really as a service.
And we've had a bit of a laugh with the Green Goddess with their exercises on the unit, and the Indian gentleman with the skipping rope and picking weights up. Yeah, that's how we've managed to do that.
And Joe Wicks, Polly, we haven't had anyone refuse a COVID test yet. We have had staff members refuse COVID tests, but not service users.
Yeah.
Alan, if you want to drop me an email. Oh, can we share any procedure regarding staff? We haven't actually got a procedure. We have our receptionist who's like, she mans reception.
Yeah, we've got a great procedure.
Yeah, go on, do it.
We've got a really good procedure in the sense that where the staff come through to pick up their alarms, our admin lady, she's set up a desk with wipes and a pen and the temperature thermometer. And we've got to keep our social distance, so we go in, we take our temperatures, record it ourselves. She wipes the thermometer, she wipes the pen, then we have to leave out of another door, and it's working really, really well. If she's getting any high readings, that's immediately taken to myself, Ellie, and the sevens. So it's worked really, really well. Any kind of concerns where staff have to go home, our procedure is that information, we've got one person taking that information, and that's Ellie, because we didn't want a lot of people involved. We want it simple. So if we've got a staff member ringing in with symptoms, they contact us for us to pass that information over to Ellie, and that one person then is informed of the results, as so is Ellie.
Yeah. Thanks, boss. That's another nice comment from you. That one goes on the holiday list.
Amazing leaders, thank you.
Thanks, Katrina. Polly, Suzanne and I have a 2-metre rule that Mr. Walsh made us quite a few, so quite a lot of staff have got 2-metre rules. So we'll often walk around the site with our 2-metre rule at each end of us, just reminding everyone what the 2-metre distance is. And then we've got some markings out in like the cafe area, so that it's a bit like going in Tesco. So we've got red danger signs on the floor on a 2-metre rule out. June, our receptionist, would shoot us if we get too close to her, basically. So we're sort of making it seriously light-hearted with service users and with staff, but we're all walking around sort of like 2-metre rules. So it's a bit fun, really, although it's really serious.
And our service users know us really well. We have virtual hugs, and we ask them to remind staff and other service users, oi, what about the 2 metres?
Yeah, no leave policy apply. Yeah, it's on. No leave policy is on both the wards.
Yeah, it's made really clear. The informal patients, it's made really clear, and it's written in care plans, and it's signed, because our service users are heavily involved in writing their own care plans. So they agree with it and they sign it and they buy into it, and we're pushing for early discharges wherever possible for them to go home.
We're not actually sending staff out to the shops for patients. We do have our own. We've got our own cafe, and we do our own catering. So the team that do our catering, who are our ancillary staff, they're getting stuff from the wholesalers, and we're also in the fair share scheme, so we get a lot of things donated to us. So we're not actually sending staff to the shops. I guess when staff are at the shops doing their own shopping, if a patient wanted something, they drop it in the basket. But wherever possible, staff are doing, as you will be doing, click and collect, and NHS safe space shopping, or how that works. So we're really hot on washing your hands and everything, if that makes any sense. So no, we're not actually sending staff to the shop for patients. Tribunal, we've done some tribunals on Zoom. That's worked really well. So it's been done completely on Zoom. I think we've done 2 tribunals, and we've done a manager's hearing on Zoom.
Going back to the inpatient shopping, I think it's really important for us to emphasise we do really have a good short term. We our maximum bed stays is 18 days, so we work very quickly on early discharge. We look at discharge, what needs to happen almost at the point of admission. So when they're in, we're talking about discharge. So when it comes to shopping for the patients or whatever, again, if anything needs to be brought in, the Zoom their relatives, the carers, or whoever, and it comes in and it goes in the sluice and it's left for 72 hours.
I think we've run out of questions. So, well, I'd just like to say thank you very much. That was some really interesting questions there, some nice feedback as well. I was a bit nervous, but I've enjoyed this experience, Suzanne.
And I would like to say, if there's anything that we can help you with, you can get our email addresses. And I was quite pleased this morning that our local infection control team, who works with the general hospital, the care homes and the full area, are really pleased and impressed how we're managing infection control, to a point that they've taken photographs to share. So if there is anything on any level that you think that we may be able to help with, send us an email.
Ellie.Walsh@nhs.net and Suzanne.Brown4@nhs.net.
There's just another question coming in about what the patients think of being interviewed on Zoom. really, really well, because what the patients have fed back at, that it feels less intimidating than being sat in a room full of professionals, and kind of on the Zoom, when the yellow box goes round on the person that's talking, they quite like seeing who's there, and it's been positive feedback.
Oh, more questions? Are we all right? I'm just looking at Harriet. Are we all right to keep going? Yeah.
Polly, really useful. Thank you, Polly. I hope you're doing well. Anonymous.
Can we see your? We did this. Did you not see the slides at the beginning? Yeah, yeah. We can share the slides if you'd like. If you'd like the slides, you're most welcome to do what you would like with the slides. If you're publishing pictures of Suzanne and I, we might like a little bit of commission on that to pay for help with our holiday fund that my boss is paying for us.
Mike Reeve.
Yeah. Yeah. So that's it. Thank you. Thank you very much.
Bye.
I don't know what to do now. I'm looking.